All right. Why don't we go ahead and get started here? So, our third panel will be talking about the elephant in the room, how COVID-19 has been impacting service provision and the attempts at integration of migrants. So, I thought I'd give just a little bit of background before we got going. When the pandemic was just starting to go global back in April, Karen and I sent out a query to all of our case researchers around the world, just asking what's happening in your neighborhood. How is COVID impacting migrants? Send us some field notes, and we got really mixed responses. Is what I was struck with was the range of different experiences. Um, in some cases, it was really negative. COVID was basically a catalyst for exacerbating tensions and exclusionary policies that were already present. So Michelle Vargas is our researcher in San Jose in Costa Rica, and she talked about how the government used the fear of public health concerns in order to further militarize and lock down on the borders. We heard the same thing today earlier from Teodora and Marina in the Balkans. We heard a similar theme in South Africa, Malawi, several other countries, even here in the States. But at the local level, we often heard the opposite, which was that COVID opened up the opportunity for really surprising but hopeful opportunities of social cohesion and migrant host solidarity. So Ruby and Ali in Amman, in their report, they talk about or in their description of Amman, talked about how Syrian and Jordanian youths were coming together to help deliver groceries to vulnerable elderly folks in their neighborhoods in order to protect them from COVID. Right here in Boston, Fernanda, who we heard from earlier, she was really proactive in helping coordinate with local networks of Latin American migrants who were delivering food and other necessary supplies to laid off migrant workers who couldn't work under the closures. And then earlier today, also we heard from Saidori and Halika about Albany Park with folks sewing masks for members of their communities. So we've really seen this wide gamut of in some ways it's helped, other ways it's been an obstruction. Now, when we sent that inquiry back in April, what we got back was really just descriptive. It was what's going on. But I think where we're at now, 8 months into the pandemic, we can actually start to get a little bit deeper. And we have the opportunity today to start to think about beyond description and actually finding good practices and lessons that we might have learned and how we might support integration in this new normal environment that we're living in. And so, I think we're just inundated with COVID description of what's going on. And so if we can, in this conversation, get a little bit deeper, what have you all been adapting to do? I'm sure there have been successes and challenges, moving services online, these sorts of things. But we're spread out all over the world, but I think we're really facing similar challenges, and we all have similar goals for the populations we're working with. So the hope is that there will be some good lessons and experiences that you all can share. And I think our rough vision at this point is to put together some kind of a report or video that will capture all of these experiences and help others learn from them. Since we haven't had this issue since '68, we've got to learn from each other. It's a learning process, and this is an opportunity to do that. So what we thought we would do is we had originally planned breakout groups with different themes, but then COVID came in and started to dominate the conversation. So that will be the one theme that we'll all talk about is how have you or your organization or what have you observed at your local level are adapting to COVID-19, what's been working, what's been a challenge. And before we get started though, so we have you all broken out into groups, and Kelsey will do her Zoom magic and you'll go into these groups. That way you have a chance to really talk, and it's not kind of in this big group, it's just hard to have a fluid conversation. Each of those groups has a leader delegated who will sort of act as a rapporteur, and once we reconvene after about 30 minutes or so, they'll just provide a summary to the group about the key points of what you talked about. But before we get into those breakouts, I wondered if we wanted to talk a little bit about overarching questions that folks might have that we'd want the groups to talk about, and then come back together on. So if you have questions that you'd like to have discussed in the breakout groups, if you don't want to just go ahead and put those in the comments or just shout out.
Charles?
Yes, please.
Hi, it's Kim. Yes, I'd also like to know, how are people getting the information that they're getting? How are they either researching or gathering information on these people, knowing that it's hard to do it face to face?
That's a really good question. I would love to hear more about that. I was interested hearing Theodora talking about the conspiracy theories that are becoming rampant. We have that issue here in the US, and it's siloed between different populations where there's some groups that think COVID was created by Donald Trump, and then there's other groups that think it results in different policies. So yeah, how is the information being exchanged, and how are these conspiracy theories and inaccurate bits of information being handled in a culturally appropriate way? That's a great question. Any other questions out there, thoughts people wanted to talk about? Graham, did you want to shout that out, please?
Sure, if I can find my unmute button. Thanks, Charles. Just the disproportionate impact on low income and minority communities as the communities that many of our clients integrate into, and particularly I'm thinking about this over the long term. So thinking the kind of post-COVID context.
Yeah, that's a good question of how does this continue? I think it's been, at least in the research environment where we are, a great opportunity to explore localization and remote management, where that's been on the radar for a long time, but it's finally forced the issue to actually go about those changes. Yeah, how making sustainable, positive changes. That's a good question. Anybody else overarching questions that you'd like to have discussed? Caitlin, got your hand up. Oh, Angelica, do you want to go ahead? And Caitlin, I'll bring it back to you. Thanks.
Yeah, I would like to really hear from everybody else. What's the impact of digital literacy skills in our clientele or the people we're working with, and how that has affected or not their access to different services in the community?
Yeah, access has definitely not been equitable. So yeah, that's an important question. Thanks, Angelica. Caitlin, go ahead.
Yeah, we've been exploring different psychosocial supports. So thinking in terms of, families that need more emotional support. We've been exploring ideas for sort of like like family wellness coaching in a virtual setting, but how to go about that. So I'm curious, especially from a child protection lens, how to address some of the stress that our families are under.
Yeah, that's a really important question. I on the one hand, people are socially isolated, so that psychosocial dimension is just even more important. On the other hand, I've heard some case studies saying that, trauma therapy over Zoom has actually been fairly effective for some populations, which I didn't expect. But yeah, that's a great question. Anybody else have other questions we want raised over in the breakout groups?
Graham has another.
Yeah, Graham, do you want to bring that up for me, please?
Yeah, it's just building directly off Caitlin's point. There's a lot of talk and I think a lot of concern around increased family violence in contexts where people are locked down. And I was wondering if anybody had any sort of insights or experience of that.
Yeah, I've certainly heard lots of anecdotes, but not a whole lot of substantive research on that question. Would be great to hear more on that. Other ideas? All right, I think we're all good to go. So what we'll do is Kelsey is going to hit her Zoom magic, and we're going to break into these small groups just so it'll be a little bit more of an intimate conversation. It'll be smaller groups. We'll do 30 minutes, so we'll reconvene at 3:45, and we'll just ask the leader at that point to share some of the key takeaways that we might organize. Joy just had one more question. Joy, do you want to raise that to the group, please?
Yeah, I was just wondering kind of how your respective institutions keep your practices intersectional, both pre and post-COVID, maybe additional obstacles that you're kind of grappling with.
Can you explain just real quick terminology? What do you mean by intersectional exactly?
Yeah, like Kimberly Crenshaw has coined the term intersectionality, referring to intersectional feminism. So thinking about the multiple facets of your, people's identities, both people working within the institution, but also the kind of communities that you're engaging with, right? Thinking about their identities layered with one another. So race, gender, class, all of these different facets. How are we taking that into account with the programming and kind of understanding our own lens through which we design programs too?
Great, thank you, Joy. Yeah, we'll have to remember we're a mix of academics and practitioners and students, so we've got to define our terms since it's not all a common language at this point. Appreciate that, thank you. So Theodora has a good example there. I'm looking forward to hearing more on that, Theodora. Why don't we go ahead and go into the breakout groups, and then we can let you chat for 30 minutes, and we'll come back together at that point. Just keep those questions in mind. Hopefully you have a few of those written down, and we'll hear more after we reconvene. Kelsey, can you beam us into our breakout groups, please? Okay, welcome back, everybody. I hope that we had some good conversations and some interesting experiences worth sharing. Let's, why don't we go ahead and go through our groups of leaders, and we can sort of report back on key findings, observations. Actually, we've still got a few folks beaming back in, but why don't we go ahead and get started. Kim, do you want to, I was in a group with you, do you want to get us started on some of the key points of what we were talking about?
Sure. Well, we were in a group with most of us afar.
And actually, sorry, Kim, since we don't all know each other, when you're presenting, if you could just briefly introduce who you are, where you are, yeah, that would be perfect. Thanks, Kim.
Yes, I was in a group with Charles and Allison and Emily. Allison Hawkins, say hello, and Emily Prey. And the most important finding was that Emily has a very interesting new job that we congratulated her on. We explored, we spent a lot of time on Jordan because that was what 3 out of the 5 of us, an area that we knew something about. And we drilled down a little bit. And what we have seen coming out of Jordan is that there's positives and negatives. The positive is potentially health because the government went into an authoritarian lockdown, and then which had a positive impact on health because I think a lot of you may know Jordan's opened back up. They're preparing for a second wave, but there was a positive impact on health. But it was also an excuse to lock down in other ways, and we're pretty convinced that that wasn't positive. What I've been hearing is that non-Syrian refugees, this is from studies we're doing in towns that are not necessarily Amman, but non-Syrian refugees are really struggling. So for example, Sudanese already been cut off and now even more cut off. And this led into a conversation about access and mobility. So I'm not sure which one of you asked about digital literacy, but we thought that was a really interesting thing to explore. We couldn't say a lot about it, But Charles mentioned that, yeah, in the past, access was always about location, proximity, mobility, transport, that kind of thing. And now that it's gotten more and more digital, what does digital access really look like? And can it fully replace physical access? And of course it can't. And because of that, things like education are suffering. Allison wasn't sure whether that was more the case for refugees than for Jordanians, but it was something to look into. We also, I just mentioned kind of an interesting finding in the US. Remittances going to Mexico and El Salvador they took a big dive in April, but they started climbing, and now in Mexico, it surpassed last year's remittance giving. And there's many theories as to why. I won't go into them now, but it's been an interesting surprise. No one predicted it. None of the economists did. And the question is why? So, but COVID has definitely had a positive impact on remittances to Mexico and El Salvador. I think I'll stop there because maybe we can get some of the other groups that have practitioners in them to enlighten us who've been working at a distance.
Great, thank you, Kim. And Halika, are you able to share your group's findings with us, please?
Yeah, thank you, Charles. I had the pleasure to be with an awesome group of practitioners. So we had Caitlin from Texas, who works in refugee resettlement, Theodora, who's a PhD researcher in Serbia to Iran refugees, but also has been involved in just more hands-on things going on there. And Jenny from New Jersey, who's also a student, but a volunteer with refugee resettlement. So we had a lot of commonalities with working with refugees. It was interesting just even to discuss what refugee, what asylum seeker means in the United States versus in Serbia, and kind of realize, you know, these countries make their own definitions based on what's fun for what works for what they want to accomplish. We saw some common themes when it comes to COVID: loss of jobs, a lot of isolation affecting a lot of our refugee clientele, and then the need to innovate. Like that kind of was a highlight on all of our different countries and situations. We also had a different, let's say, exposure to COVID. Serbia is like it was less cases, less harsh, but still the government used the COVID as a way to kind of push down on refugees and close the camps and pretend they're putting a really strict eye on things, but in reality it's very lax and there's not a lot of cases. So that is something to celebrate. Where in the United States, it seems like cases have been more affecting immigrant families, and even when we don't have COVID in all of the different communities, the effects of lockdown and shelter-in-place orders affect everybody. But our different cities are in different places. So Texas, they allow children to go to school or go remote. Where in Chicago, we're completely closed down, remote learning, probably until the end of the school year. So that brings different challenges. It was sad to talk about funding because we realized that based on these situations, funding is different. So when we talked about technology, realized that in Texas and New Jersey, it's more like it's on the family to figure it out. We're here in Chicago because of the whole city going in shut down. The public school is the one responsible to provide technology. Some good innovations we heard of was just hearing from Theodora about Iran refugees doing Skype lessons and using that as a way to make some income for their families, even though they were locked down and unable to access work because of the way camps are closed at the moment. Jenny shared really good initiatives that are continuing in New Jersey, like organization that shares furniture, gardening, and face masks, and also Caitlin was just sharing about how they're continuing their cut drives and providing clothing, but kind of change the way they do it in order to serve everybody. And we share in Chicago, we got some funding to to raise up community ambassadors. So we identified language groups that were really needed for our immigrant communities, and we empower them to do health literacy and digital literacy workshops and training with the people from their language community. So that was one of the things I share with the ladies as far as how we adapted to these COVID realities.
Very cool. Good to hear about all the innovations going on. Thanks for sharing all of that.
Yeah.
Let's see, Aaron. That is a gnarly beard. Fantastic. I almost didn't recognize you. Can you share for your group, please?
Yeah, gladly. So I was in a group with Gordana, Hannah, Emma, and Victoria. So we spoke about refugee and immigrant communities, both within the US and at the border, or borders, how conditions at the border were already poor, and the pandemic exacerbated conditions there, and how many organizations have had to transition, and it makes delivery of assistance much more difficult. However, Gordana, she shared a positive example of how in Boston there has been a lot of coalition building among organizations to care for these groups because of their greater difficulty in accessing aid and how they often fall through the cracks. We also spoke about the difficulty of creating long-term solutions during emergencies. NGOs have been able to respond more effectively than their government counterparts because they're often more dynamic. They've played a very important role. However, there's also this issue of how the organization's goals are often organizational survival as well as helping people, which can sort of hinder that response. So another important topic that we touched on is how inequality is being perpetuated by crisis, how income, minority status, and zip code is the biggest determining factor of outcome, due to a lack of access to care and having to undertake risky work during the pandemic. And I'm going to share an article in the chat from a Fletcher alum that's about intimate partner violence during the pandemic. It has some great statistics, and but yeah, it's a great article on the topic. So thank you.
Perfect. Thank you for sharing that. Could you go into just real quick a little bit more into that zip code still is the main determinant of access? Is our group, and we've heard from others talking about how now that things are going virtual, that physical location seems to be less important, but that doesn't seem to be the case. If someone else in your group wanted to speak to that real quickly.
I'm happy to take a stab. I think one of the key determining factors there, it goes back to these pre-existing issues before the pandemic. And within the United States, I think a big issue that haunts us is redlining, and how minority communities have sort of been grouped into certain zip codes, certain areas that were deemed less desirable throughout the 20th century. And, tying that into how usually it's minorities that are stuck doing the labor that is more dangerous, essential labor these days. And I think those tie together to create sort of this crisis that we're having. And also lack of access to food and medical care as well. But I would love for other people to jump in.
Yeah, that's a really good point. I'm thinking here in Boston, it's construction and delivery drivers and these sorts of sectors that, yeah, are a lot higher risk and essential, at least as far as the sector lists are concerned. Good, thanks, Aaron. Yeah, maybe we could get more into that conversation after we've all shared. But let's continue on. Mina, are you with us? Are you able to share for your group, please?
Yes. Hi. So I'm Mina. I'm a student at the Fletcher School, and I was in a group with Marina, Hope, and Layla. A lot of our conversation was around the question posed around digital literacy that Professor Wilson also mentioned in her recap. We didn't get to literacy. We were more trying to focus just on digital access. And and how that impacts how having access can either provide more opportunities or create more setbacks. So, for example, Layla was mentioning how parents of children in elementary education, of course, this issue of connectivity and affordability for resources to learn virtually is a challenge everywhere. But for refugees who are kind of trying to navigate a new home virtually, it adds another layer. And then also how it goes both ways. It also impacts practitioners who are trying to get information about the situation happening on the ground, and who may normally depend on talking to people through an interview, but they might not feel comfortable in their home to share their situation. And then on the flip side, having digital access creates more opportunities. Hope was sharing how the English classes that she was teaching in Chicago, there were times that more adults could join because they could afford the time to join. And then also there were more volunteers that were able to join, and this really this topic of civic engagement came up and how that can really have an impact. And then we didn't really get into it, but Marina was talking about how in Serbia the response with the community is very different, and how and why that is, and what creates this difference in reaction. So we talked mostly about digital access, and then also community response and civic engagement and how that impacts refugees' experience.
Good. So a lot of similar observations starting to line up here. Thanks, Mina. Let's go to Danny. Can you share for your group, please? Introduce yourself, say hi.
Sure. So my name is Danny. I am a second-year Fletcher student, and I was in a group with Carrie, Paul, and Yulia. So we talked a lot about various places, but particularly Lebanon, Egypt, Iraq, and Ukraine. And one theme that kept coming up, which I think is everyone else has highlighted as well, is that COVID's really highlighting the problems and disparities that are already present in the system. And we talked a lot about the intersection between health access and housing. So in Colombia, the displaced don't have refugee status. And so that offers one kind of trouble and challenge. In Lebanon, many of the refugees are living in tented settlements, and there's concerns that the refugees have better access to healthcare because of UNHCR than other Lebanese, so that can cause some sort of social tensions. And in Uganda, there's official refugee camps, so that operates differently. Yulia talked a bit about the situations for Indian students who were living in Ukraine and attending university, and then were unable to return home, but were not able to receive healthcare or any sort of PPE when living in the dorms, and so they just felt completely abandoned. And in Egypt, Paul talked a bit about how there's many Ethiopian women who are working as domestic workers, and then when COVID happened, many of them were laid off or didn't have access to as much work, and so they might have been evicted, and it just caused this whole cycle of challenges related to the housing and healthcare system. And the interaction between different types of NGOs and refugees and governments all kind of plays into whatever the eviction policy is and whatever the healthcare access is. So again, different factors that are aligning in both similar and different ways in these different places.
All right, thank you, Danny. Let's go to our last group here. Joy, can you share what you all spoke about, please?
Hi, yes. My name is Joyelle, and I'm an anthropologist based out of New York, but I worked with the GDON Arabic Community Action Summer Program based in New Britain, Connecticut, and I had my breakout room with Graham, who works in the IRC predominantly on issues of integration and asylum within the United States and Europe, as well as Rosemary and Jeff, who are students within Tufts University. And so we had a really nice conversation. Graham and I had discussed a little bit about how our respective organizations were kind of able to adapt to COVID-19 regarding refugee integration. For him, he found that it actually helped streamline a lot of issues, and in making casework now delivered online much more efficient. No bus, no childcare, kind of holding up things. These remote interviews and internships for remote interviews that they're able to conduct was really able to help him and his organization in a way that perhaps in the future they might continue instead of reverting back to old ways. Whereas for my organization, typically the program is conducted in the summer, and so we were not able this past summer to carry it out. A major issue was the digital divide, or a lack of Wi-Fi access and connectivity amongst many of the respective refugees and immigrants that we typically work with. And so we've really taken this time to kind of think through how our program is going to look like in the future. We've connected, Meha and I, she's one of the founders of the organization, with other organizations, and networked and connected with them to see how we might be able to in the future offer ESL classes virtually online with another organization and kind of expand our network. We also are thinking very critically about how we are going to improve our programming to become more intersectional, through this networking as well, and kind of thinking through everything that we do.
Terrific. Thanks for sharing your conversation, Joy. Really interesting. Okay, thanks for everybody. It was good to hear from you. Why don't we go ahead and open up the floor now? If there's anyone who didn't have a chance to speak up or anything that we wanted to add, please go ahead and either raise your hand, put it in the chat, or just go ahead and shout it out. Or everything was pretty much covered at this point. All right. I think we've covered a lot. COVID is a tough conversation because it's we're inundated with it constantly.
Joy actually has a question.
Sorry, what's that, Kelsey?
Joy has her hand up.
Oh, sorry, Joy. Please go ahead.
Thank you. I was just curious to hear how, with connectivity issues that, some of your organizations are obviously facing with refugees, how have your respective organizations possibly adapted to that? I'm very open to hearing new ideas. So for instance, one of the things that my organization was doing, because we had to close down, we actually did fundraising to help pay for electrical bills for some of the families that we work with. But thinking forward in the future, what are things that we could possibly think about to better reach, our members?
Yeah, I'm sort of reminded of the old crisis response versus development nexus conversations. It seems like we're kind of there now with we've dealt with the immediate crisis, and now we've got to figure out how to make longer term systems. Do any of the practitioners in the group here have
I mean, we're not, this isn't progressive. We did purchase and make available laptops that we've been delivering to people's homes. We've been doing the technical setup. We've been doing financial assistance for everything from rent to electricity. They do agree to technically return the software or hardware in the future, but they're enrolled in programs right now. And we've had a higher enrollment. That's been like other people have said, it's been pretty impressive. We've got 95% attendance in our ELL classes. And that wasn't always the case pre-COVID, because people don't have to spend the money to travel. So that's been a really great outcome. But we also benefited from the city of Boston, did a large fundraising to support immigrant refugees in greater Boston. So we were able to tap into that money to make some of those additional resources available.
Wow, go ahead, please.
Yeah, thank you. I think for us, we started really trying to figure out what were other people, like what were other sources of funding. like especially when we first went remote, the Chicago public schools were not mandated to provide devices to their families, but they had like a limited amount. So we just really made sure that to push through that our families will be included in that limited amount of kids that receive devices. And it was just our work at advocacy and making sure that they got it. And then little by little, I will say we were privileged because the city's response was really wide, and they created Wi-Fi programs. Now the Chicago public schools have to provide devices to every child. So in many ways, we were privileged in that sense, but I would say there's always resources. You just kind of have to try to find the right networks, and also lending is a good way to go about it. Like we, with the limited resources we had that we could have put into doing devices, we just have them available for short periods of time. So like for 8 weeks or 2 months, depending on the type of class. So families can take them for a little bit and then bring them back. And most of our English classes start using platforms that students wouldn't need to use computers for, like Zoom and YouTube videos, instead of going some other way. We know it's still challenging, but it's better if you try to use things that if you're doing education programs, to try to do it in a way that allows for the use of phone. So WhatsApp is a good way our tutors connect with their children, instead of having to provide a child a device for tutoring. We just use WhatsApp, things like that. Could be adaptations.
Those are really great examples. Thanks, Angelica. Caitlin, did you want to raise the examples that you spoke to? And I'd also be interested in what actually is included in a digital literacy curriculum for you.
So I can't speak to the specifics of the curriculum. I just know that one of our volunteers that was highly skilled agreed to create the curriculum for our clients, and now they're moving through a digital literacy curriculum along with the ESL classes. So that's been super helpful. We've gotten good feedback on that. And then, yeah, appealing to the service providers, saying, hey, now, a big portion of our population isn't getting the same bandwidth as the rest. And then using volunteers and donors to fill in the gaps where schools are not providing enough technology. Like there are some school districts that, you know, make sure that every student has a Chromebook, but even that isn't necessarily enough for families that are having to, you know, continue their ESL classes completely online. And so like the parents also need a Chromebook or, you know, a tablet to be able to continue their job training and ESL.
Great, thank you. Any other thoughts or other inputs at this point?
Charles, hi, it's Kim.
Yeah, Kim, go ahead.
Thank you. So just at the mention of WhatsApp, it prompted me to think, to ask anybody here if you've used it as a form of research, eliciting responses. I ask because I know that it can do that. I'm not exactly sure how. And so I don't expect an answer right now at the very end of this session, but just that maybe we could have another conversation about it at some point, which is researching in COVID and what are some, you know, interesting ways to elicit information.
I can speak briefly that we have used WhatsApp for clients sending us documents that are important, for example, social security and sensitive personal information, because WhatsApp is encrypted. So what we will do as caseworkers is we will have WhatsApp web open in our work computers, and when the client send us like their social security card or the employment authorization card, we'd right away just save it into the drive from our work, and then we will erase it from our phone so that it will never like touch our device, but it will just go straight from their device to our work computers. So I would say probably will work for research because it is encrypted both ways.
Oh, that's really helpful. Thank you.
Mm-hmm.
Awesome, thanks, Angelica. Anyone else have any more thoughts on the research side of things, collecting data and figuring out the populations that you're working with remotely? Graham, did your leader mention something about conducting virtual interviews with clients?
Yes, Charles. We had a project in which we had planned to do some preliminary exploratory interviews with clients in person, and then the pandemic happened, and we decided to try and switch it over to phone-based interviews, and it's more or less turned into a little bit of a different kind of exploration into the sort of effectiveness of phone-based interviews and what's required to really make those work. It's still early days, but I looked at some of the evidence for phone-based interviews, and it seemed that, from what I could find, there isn't much out there that phone-based interviews can work as long as the person who is doing the interview or facilitating the discussion has some kind of existing rapport with the person on the other end of the line. That seems to be quite important for some kinds of data that's being collected. My experience so far is that I think I do miss the in-person contact, partly because you can't see what's around. The project that we're doing is looking at early housing experiences, so I think we really lose a lot by not being in context and being able to observe and structure discussions around the things that are around. So it feels a little superficial and a little light to a little hard to really kind of dig into certain things. It's also, because sometimes it ends up being a three-way conversation and sometimes a four-way conversation, depending on the interpretation requirements. And that really complicates it because, somewhere along the line, somebody's signal is going to go. So, it feels like this sort of constant struggle to keep the technology working, which kind of gets in the way of an interesting conversation. But it's better than nothing, and we're making do. But I don't think it's a good replacement for in-person interviews.
Thanks, Graham.
I'd love to hear if others have had some experiences.
Yeah, Paul here says he has a very mixed experience. We'll get to Paul in a second here. And then any of our research assistants, I'd be interested to hear from you too. Many of the folks here have been paired with a refugee researcher in some town around the world managing their data collection remotely. And I think that rapport part that you talked about, that trust from abroad is really critical. But if any of you wanted to share your experiences, and then we'll wrap this up so that we have a few minute break and not get Zoom burnout before our last panel at 4:30. So Paul, if you wanted to share, and then anybody else real quick, and we'll move along.
Yeah, this wasn't for refugees in towns. I've been working sort of in Iraq and on Iraq from the US for the past 6 months, but we had been invited, the organization I worked for, to work in this town by the mayor to support the implementation of a local peace agreement. And we wanted to do an assessment to better understand, how we could do this. And so we had our Iraqi staff from a nearby town reach out first to people they knew in this town as a way to have that existing social relationship. Those interviews started to go well, but then we tried to access more people to have them, those people we spoke to refer others to us, organizations who had worked there refer people to us, and that didn't really go so well. People didn't really want to talk. And even the interviews that went well, like in Cairo, we've done interviews that go on for 3 hours. People are just so engaged and want to speak about topics. But, 45 minutes on the phone and people are like, all right, I have other things to do. And then as far as talking to more the mayor, government officials, security actors, they just had no interest to talk on the phone. And so it was a very mixed experience. But as Graham said, it was sort of better than nothing.
Thanks, Paul. Karen? Yeah, go ahead.
Yeah, I just think there's some big issues around conducting interviews on the phone. I mean, security for one. You can't be sure who's listening on what kind. I mean, I think it's just a huge problem doing this. I mean, Graham and Kim, I don't have to tell, or Paul. I mean, they're just. I wouldn't talk to anyone on the phone beyond kind of basic info that is anonymous. So I wouldn't expect people to talk to me on the phone about anything. So just as you say, Graham, it's sort of a maybe the best we can do, but definitely not optimal.
Yeah, that's a real limitation, I think. And
yeah, and to compound that, Karen, some of the work we're doing in Kenya now, we are, I think I told you about this, where we're asking refugees who are literate in English enough, right? They don't have to be, you know, Pulitzer Prize winning journalists, but can they communicate? And they're sending us their stories. And some of it looks very sensitive, like, you know, where they've been and, you know, exactly all their roots. So we don't really know what to do about that. They're sending it over email. So so what they do essentially is they send us their story, and then we comment and ask a lot of questions using, you know, the word comments thing, and then they go back and they answer those comments, and they're really happy with the outcomes, because then Julie has 2 Kenyan writers who are professional turn those stories into something they're very powerful, right? So all the information's there, but they process it in such a way that it becomes very interesting. But I don't know, I'm a little uncomfortable with how we're getting that information. So I agree, it's a problem.
Yeah, and I think, I mean, we only have to talk to Diane Mazarano, who has some horror stories about her computer being hacked and by government agents and other ways of being hacking. It doesn't even have to be government. I think the whole thing is just really, really problematic. And so we have to be super careful about all of that.
On the arts side, just as a transition to the next panel, because I can't help myself, I'm loving it. Like I did all my suitcase story programming in person before, and now we're able to feature people from around the world. We're able to unintentionally, because you know how Zoom defaults to like recording unless you turn it off. All these people who are working with me on a suitcase story, they're having their stories recorded just as they're practicing. And so they have all these collections of stories they're going to have for life, because they're finally creating an 8-minute piece, but they've got an hour or 2 hours of stories for their family for the future. And that's been really fun. We are, as now as a practitioner, we're not asking deep private information. All of our legal services have had to continue in person in our offices, and the USCIS offices are not well distanced. So we've been having lots of thoughtful conversations about how to protect our staff, clients, and everybody. But yeah, I mean, there are some silver linings when you try to find them.
Yeah, even for this conference, there's a whole lot of people who are now able to join who would not have been able to if we were in person. Thanks, everybody. I think the conversation has shifted somehow into a research methods discussion, which is almost like we have 5 or 6 methodologists in the group, which is a great conversation. It's just beyond the scope of COVID-19 and integration. Again, like I said, after the first panel, we'd really encourage these conversations to continue now that the panel is done. I think we were talking, Kim, one of the main advantages of RIT is just our network, being able to connect. We just happened back in April to become a hub for a bunch of Boston area restaurant workers who were trying to give food distribution to laid off staff who were in large part migrant workers. So, you know, you've gotten to know a whole lot of people who are experiencing similar challenges. If you're feeling frustrated or looking for new ideas or things, please coordinate with each other after this evening. We'll take a 5-minute break here, just so because I think the Zoom burnout is heating up. That way we'll be fresh for the next panel at 4:30 with Marina, talking about bridging us from all the policy research talk into the arts and how arts are critical to integration. And then if you're not able to make that panel, please come on back at 7 for our presentation of suitcase stories with Cheryl, and it's going to be a really an amazing event. So the fun continues. We'll take a 5-minute break. Thanks everybody for adding in, and we'll talk again soon.